Great,
So
thank you.
this is a slide I use. When I go to health organizations, so I'm in cybersecurity. I actually work for a healthcare organization. I've been doing cybersecurity for 20 years. I got into healthcare right in about 2015 when I started working for Optum. And the reason is primarily because of all of you. I want to thank KDIGO for having us. I want to thank Dr. Kukla for suggesting KDIGO invite me. And I want to thank the Mayo Clinic, Dr. Kukla and Dr. Dwan for essentially saving my life. But let me talk a little bit about what I went through here. So I came up here with a plan to talk about my struggles through the whole thing. But I changed my strategy about halfway through when I realized all of you already know what the patients go through. What I think I want to talk about, and I'm going to apologize because you said not to talk about it, right? But it's the lifestyle. Essentially, my problems began in my early childhood. I grew up in Wisconsin, Minnesota, where I was told to clean your plate. My family was all overweight, those kinds of things. And let's face it, like the lessons you learn early on in childhood, they stick with you for life, right? And so one could almost argue that, finding out that I had polycystic kidney disease and going through renal failure was the best thing that ever could have happened to me, because by that time I was already overweight. I was already gone, right? Without bariatric surgery and without losing that weight, getting a kidney transplant, I wouldn't have, I might not be here today, right? And I want to bring up a topic for consideration here. So, lifestyle, and everything that goes along with that, right? Including depression, social anxiety, all that stuff. We now have a generation that doesn't know what a rotary phone is. They don't know how to ask another person out on a date face-to-face, and they don't know what it was like before computers existed, right? So along with that, we're going to see, and I don't have statistics. If I knew what I was going to talk about this, I would have actually brought something. But I do have some experience with this, and I do believe that this problem, the problem with social anxiety, the problem with depression, the problem with obesity, is going to continue to snowball because of the lack of public policy around social media and those kinds of things. And I know that doesn't directly correlate to CKD, but it absolutely indirectly does. So if these things aren't dealt with soon, I do actually think that this is going to get worse. And then the other thing I want to talk about, oops, how do I go back? The other thing I want to talk about really quickly is my biggest struggle in trying to get treatment was the interdisciplinary, right? So I went to endocrinology, and then I had to go back to transplant, and it just didn't seem like that communication was working until this program that Dr. Kukla and Dr. Dwan started. And I feel like after that happened, everything just clicked. Everything just fell into place. And I think that if that program was copied everywhere, I think it would solve a lot of issues. But please.